Did your doctor prescribe this for your sinus infection? Mine sure did. And it's totally wrong. I should not have been given this for a sinus infection. This is called a Medrol dose pack, and this is totally inappropriate if you have a sinus infection. Also, antibiotics, totally inappropriate most of the time if you have a sinus infection. So what should you do with them? That's where they really should go. If you stay to the end, I'll tell you what to use instead of prednisone or Medrol for sinus infections. Hi, I'm Dr. Megan, your prednisone pharmacist. And why would I make steroids for sinus infections? Well, it turns out there's no good evidence that they help, that they work, that there's any benefit over not using it. So they recently did a study in 2020, they published it, and it said they found almost 10 million people who'd been prescribed steroids for an acute respiratory tract infection. What is an acute respiratory tract infection? Could be anything from acute bronchitis, sinusitis, pharyngitis, otitis media, ear infection, allergic rhinitis, influenza, pneumonia, and unspecified upper respiratory tract infection. I've personally been diagnosed in the last few weeks with an otitis media, that's an ear infection, laryngitis, which wasn't listed, and acute sinusitis or a sinus infection. And so they've given me amoxicillin for 7 days for the ear infection. It didn't clear it up. So I waited a week, still no help. Went to a different doctor. They said I have a sinus infection, and then prescribed antibiotics and the steroids. And in this study, when they had 10 million people with a possible acute respiratory tract infection, almost 12% were prescribed a steroid, glucocorticoid, corticosteroid, and it could either be an injectable one or a pill like I was prescribed. And what was amazing is when they looked across the United States, there was a remarkable geographic variability, is what they said. The patients who lived in the Southeast were 14 times more likely to receive a steroid injection as opposed to people who lived in the Northeast. And that the rate of prescribing of this type of thing for an acute respiratory tract infection almost doubled from 2007 to 2016, even though there's zero evidence for benefit. One of the doctors who published it said specifically, there's practically zero evidence of benefit. This is Dr. McCool. He said, it's important for the public to understand that most upper respiratory tract infections are self-limited. No intervention is required. They resolve on their own if you don't seek care. Most of the time, like about 70% of the time, if you get an infection, a sinus infection, it will go away without the doctor doing anything. And that when they compared this to placebo, like fake pills, it might have cleared it up a little faster. Let me read specifically what it said. We recommend not using systemic glucocorticoids. That means steroids that go to your entire body. When given in addition to antibiotics, oral glucocorticoids may shorten the time to symptom resolution or improvement. So you might have symptoms resolve a little sooner, although the benefits are small. And unlike topical glucocorticoids, that means something that goes right on the place where the problem is, like a nasal spray, the full-blown systemic glucocorticoids pose a potential risk for side effects that outweighs the clinical benefits. The side effects can be horrible. You want to find out what those are? I've got to be clear with you. Steroids have saved my life. Prednisone, I took it for a bleeding disorder, and it saved my life. These drugs can be complete miracles when they're used for the right reasons. But when it comes to an infection up here that's short, there's no benefit, okay? So let me read exactly what your risks are so you can really make that calculation for yourself better. So as few as 3 days of treatment, so that would be day 1, day 2, and day 3, can cause gastrointestinal bleeding, sepsis, that means your entire body can get infected, and heart failure. 3 days, even in relatively young, healthy people like me, just 3 days can cause an increased risk for those things. elevated risk of diabetes and osteoporosis if you receive 1 or more shots per year of steroids. Dr. Dvorin, he said that even brief use of steroids can cause elevated blood sugar, elevated blood pressure, mood and sleep disturbances, fracture, broken bones, and blood clots. Even short-term use can cause increased risk for all of those side effects. And most of those are relatively rare. The typical person isn't going to get all of those big, scary side effects, but what are you more likely to have? You're more likely to have hunger cravings, rage, mood changes, sleep disturbances. And that's crazy. Like, why would you want to take a drug like this that's going to cause you to lose sleep when sleep is one of the very most important things you need to recover? Like, you can hear in my voice, I've lost my voice. I have laryngitis. Like yesterday, I could barely talk. Today, thank heavens, I'm getting a little bit more of my voice. And I have the typical symptoms for a sinus infection. I had a cold about 4 weeks ago, and so did everyone in my family. Most of us lost our voice at that point. And then 2 of us got ear infections because we got so much swelling and pain in that area. And I took the antibiotic like I was supposed to, and I thought I was getting a little bit better. My voice did recover. And then over the last few days, it's gotten worse. The ear pain isn't getting any better. I have hearing loss, and my voice, I lost my voice. I've got coughing. I've got pain and fatigue. I just have not felt like myself for almost a month now. And that's pretty typical when it comes to a sinus infection. It's pretty typical that you will have a viral infection, like a cold, and then a few weeks later, you'll get sick again. That's a typical bacterial sinus infection. And most of them do go away on their own, which is fantastic. But if you're having complications, then you might need an antibiotic. A typical antibiotic they would start with would be amoxicillin, which is what they did with me. They might add the little thing to it called clavulanate, and that makes it the Augmentin brand name. And that one can be really hard on your gut. And so a lot of these antibiotics cause a lot of side effects too, and the benefit may not outweigh the risk. My doctor, because I'm allergic to a lot of antibiotics and I'd already failed amoxicillin, prescribed cefuroxime. And that's a 3rd generation cephalosporin. And I'm hoping it's going to help because I'm at the point where it's pretty clearly a bacterial issue, and it's been more than 10 days. And so at this point, bacterial infection is likely and it needs to be treated because I've already failed 1 round of antibiotics. I'm getting to the point where it might be chronic sinusitis. And so the doctor said, if this doesn't help for 10 days, then to come to refill it and to do another 10 days because he doesn't want it to become chronic issues. So the only people that really benefit from steroids and antibiotics who have sinus infections are those who have chronic sinusitis, which is more than 4 weeks, usually more than 12 weeks of nasal congestion, possible nasal or facial pain, sinus pressure, your nose is always running. Those are the main symptoms of sinus infections that are long-term. And if you're having lots of congestion, then they might actually need to do a CT scan to see inside your sinuses, seeing an ENT with their fancy scopes, and to see for sure if you have sinus infection and to make sure you don't have sinus polyps, because that's who really benefits from sinus treatment with steroids. And usually this isn't enough though. Usually you would need longer term than just 6 days of steroid treatment. And so it would probably be more like prednisone, 30 milligrams for 10 days, 2 weeks, or even longer. It's really dependent on your doctor and how severe your situation is. You wouldn't generally see over 60 milligrams of prednisone for somebody who has chronic sinusitis. So that's who can actually benefit. So what can you do instead? If I'm saying, look, I know you're suffering, I know you feel yucky, don't do this, throw it away, what should you do instead? So I'm going to take this away and show you what we should do instead. And this is in order of most benefit. Step 1, pain medicine. If you're having sinus pain and pressure, then over-the-counter medicine can help. There's acetaminophen that is safe for most people except those with liver problems. and you can take up to 4,000 milligrams a day, which in this case, the extra strength 500 milligram tablets is 8 of these per day. Most people is that safe. And then ibuprofen is another possibility. I've been taking both because I've been so miserable. And you can take up to 12 of these per day if you're really struggling. Start with just one and see if that's enough. You can go up to 4 per dose 3 times a day. And who should not use this is people with kidney problems, heart problems, and gut problems, which is a lot of people. So ibuprofen, naproxen is also a possibility. Next one has evidence of benefit. I said that the Medrol dose pack or prednisone pills, they're going to your entire body. That means they're causing side effects everywhere, right? So this is called a topical because it's going to just one place in your body. It's a nasal spray. This is one I recommend. It's fluticasone, and I get most of my over-the-counter medicines at Costco because it's cheaper, usually per dose. And fluticasone is a steroid like prednisone. So they're both steroids, but the difference is this is only going in your nose, whereas this is going to your entire body, causing mood changes and all of those horrible side effects that I mentioned before. So this actually does have evidence of benefit. Steroid nasal sprays. There are other versions, but fluticasone is definitely my favorite. And you just blow your nose first, cover your one nostril, and then you don't want to point at like your nasal septum in the middle of the nose. You want to point straight up and squirt it while you're sniffing. And then repeat on the other side. And you can do up to 2 sprays at a time. This is what I'd recommend over the steroids, over the pill steroids, okay? The next type of treatment that would be helpful would be another kind of nasal spray that doesn't have anything in it. It doesn't have any medication in it. It's just saline, just salt water. And those are fantastic to just kind of moisten and loosen the mucus that's building up in the sinus nasal area. And then another option is called a neti pot. I have several of these in my house. I have this fancy porcelain green one. I have this blue plastic one. And they are kind of weird, but like they feel super weird when you use them, but they're fantastic. So you get this and you get these little sinus rinse packets. I'll just open it up and show you. So this little packet has salt essentially in it, and it dissolves easily. And what you do is you pour that packet, the contents of the packet, into the neti pot, and then you got to use bottled water or otherwise sterilized water. You don't want to use just plain tap water. And you pour it in up to the line. There's a little line here. You probably can't see it, but you want it to be exact. You want the ratio of the salt to the water to be precisely exact. Otherwise, it can really burn your sinuses. The consistency of that salt water is the same. It's called isotonic, the same balance of salt and water and things as what's inside your mucous membranes. And so it won't hurt if it's the exact right ratio. If you use too much or too little water and salt, then it'll really hurt. So you want it to be exactly right. And then this is currently room temperature water. And if I put that in my sinuses, it'll also hurt. You want it to be exactly the same temperature as your skin. So when you put your finger in it, it won't feel hot. It won't feel cold. It'll feel the same as if you touch your finger in it. So that is a fantastic option for people who have sinus issues. I'm going to do that as soon as this video is over. Another thing is if you're having lots of congestion, and especially if you're like me having eustachian tube dysfunction, ear infection, that type of thing, then a nasal decongestant like this with pseudoephedrine is fantastic. So this is the one I use. I use the immediate release, maximum strength, and I get the max amount of tablets at a time I can possibly get because you have to like show your driver's license in order to get these at the pharmacy. And if I'm gonna have to do it, I'm gonna have to just get as many as I possibly can all at once. You can also get extended release versions that you don't have to take as often. This you're gonna have to take every 4 to 6 hours. Convenience, you can use the extended release version. The reason I don't personally is because I want it to wear off before I go to bed, because this can be stimulating, make you feel a little anxious or jittery. This isn't appropriate for people who have high blood pressure and it says, or people who are taking a monoamine oxidase inhibitor, or have thyroid disease, have enlarged prostate glands, or diabetes. So there's a lot of people who can't use this, but for somebody otherwise young and healthy like me, this is a fantastic thing to help thin out the mucus. It's called a decongestant. And I personally take 2 of these at a time every 4 to 6 hours. And I make sure that the 4 to 6 hours is going to stop before bedtime so that I can sleep. And then the next one would be antihistamines. So this is called a first generation antihistamine. It's just like Benadryl, these little pink pills. And I take this at night. Some people, antihistamines aren't helpful because it's drying out the mucus too much, and that can be painful and harmful. But for a lot of people, this is really helpful. And so I take it at bedtime, and I don't want to take it during the day because it makes me drowsy and makes me want to fall asleep. Some people get what they call a paradoxical reaction, and if they take it during the night, they won't be able to sleep. So make sure you know how it works for you. But for me and for most people, it makes me really drowsy and helps me sleep while I'm having the sinus infection. During the day, you can take second generation antihistamines like Allertec, which is cetirizine. The brand name is Zyrtec, or loratadine. And there are several in this class of drugs. They all work pretty much the same and all have very minimal side effects. So you can take this during the day. These are especially helpful if your sinus infection is related to seasonal allergies. So definitely take these. In some cases, they'll ask you to double the dose, but definitely check with your doctor before doing that, because normally you just take 1 pill of one of them per day. Next, we have guaifenesin. Is a mucolytic is what it's called. It helps break down the mucus in coughs, like in your postnasal drip and stuff. So this one is just plain guaifenesin. The one I personally take and I've needed every 12 hours is Mucinex M, because I have had this cough for 4 weeks and lots of mucus. That's hilarious that I had it right at that moment. Because I haven't taken this yet today, because I was going to show you all the pills that I'm currently taking to deal with my sinus infection. So I take this every 12 hours. It's a combination product. It has both the guaifenesin and dextromethorphan. So it's like these bilayer yellow and white tablets. And it helps to both suppress your cough. That's what the dextromethorphan does. And thin out the mucus of the cough. So I take this like faithfully every 12 hours for the last 4 weeks. This is my 3rd box of these. And another product that I don't currently have with me at the moment, that if you're having a cough along with your sinus infection, is something that's just plain dextromethorphan cough syrup. My favorite is called Mucinex. It's like an orange bottle, and it lasts 12 hours as well. So that one's fantastic. An extended release cough syrup that you just would take in the morning and at night. It's a lot easier for me to just swallow a pill, because I generally remember after I brush my teeth, and I don't want to have to like have a like sticky syrup after I brush my teeth. And then if you do have a cough, something that's just honey, like a honey tea, a honey cough syrup, or just put some honey in some hot water, is great for coughs. Prednisone isn't. It doesn't really work. And then this is my favorite cough drops. They have all of these different herbs in them, and several of them have a lot of evidence of benefit. And so I've been using quite a few of these little babies, and they taste fairly good. They aren't like other cough drops that are like basically fancy candy that are just kind of like numbing candy. These actually have herbs in them. So my kids aren't as likely to just eat them as candy and use up the entire bag before I can even get to them. And then because I have a history of asthma as well, I have been using my albuterol inhaler, and I always use a spacer on it. This one's a pretty cool spacer because you can actually store the inhaler inside of it. So that's pretty awesome for traveling. And then if you want to use this neti pot, they also have like a nasal spray version of the neti pot. This one I find a lot harder to use, even though this one's like really disturbing, pouring something in one nostril and it coming out the other. It's really disturbing, but the feeling after is so fantastic because you can actually breathe. So those are the products I recommend instead as a board certified clinical pharmacist. And I do not recommend using steroids while you have sinus infections. I'd use all of these first. And you, like, if you decide, you know what, I feel so horrible, the sinus infection is so awful that I think it's worth it to me to get just a tiny bit of benefit, then go for it. And you can use these all in combination with it. Although I would recommend to avoid ibuprofen in combination with any steroid. But if you do choose to use a Medrol dose pack while you have a respiratory tract infection, then let me show you how to use it properly. Medrol dose packs are pretty funny because they have two sets of instructions. They have the instructions right here and they have the instructions right here. And they don't match. One of them says take 2 at breakfast and then 1 at lunch and dinner and bedtime. Don't do that. Follow these instructions right here that say take the whole day's dose all at once first thing in the morning. Don't take don't separate them out. Just take them all at once. Do yourself a favor. Take them all at once. First thing in the morning. That's mimicking your body's natural cortisol and is going to minimize your risk for side effects like insomnia. Okay? That would be day 1, day 2, day 3, day 4, day 5, day 6. All at once, first thing in the morning. Day 7, you're at 0. Awesome. And if you still are struggling with prednisone or you have chronic sinusitis and you're stuck on prednisone, you should definitely download my prednisone checklist. It has the top mistakes people make and what you can do about it. Signing off is Dr. Megan, your prednisone pharmacist.